Details of this Senate health care deal won't be revealed for a few days. And of course, Representative Kucinich just said as soon as he gets to look at it, then he'll be able to assess it. But one thing is clear, millions of new people will be added to Medicare, a program most people agree is going broke.
Dr. Sreedhar Potarazu says this will be a very costly mistake. How so and how much?
Well, you just heard the senator talk about, the congressman talk about people being indentured to insurance companies. That's quite a statement. 35 million people that are going to be affected by that age group. And if we push them into Medicare, as everybody has said throughout the day, in an insolvent system where $90 trillion is not even accounted for, we don't have the money to pay for these people. And it's very ironic that we're going to go into a system that we said needs to be reformed, or we have to cut out fraud and abuse, that's currently insolvent, and yet put in millions of people back into the system to get their care. We're pushing them over the cliff. The AMA is against it because we're cutting reimbursements to Medicare and what we've already seen, so that doctors are going to continue to get paid less to see more people, and the same applies to hospitals. It makes no sense.
Okay, so let's just look at this overall, though. There are people who have Medicare. They absolutely love it, but we do know that it's running out of money and that there's so much waste and fraud. Here's the focus, though. What if they were able to find a way to put that money right toward making sure that more people could be a part of the Medicare process, or would doctors still be left on the short end of the stick?
The only way, Liz, that they can make sure that the right people are getting the right treatment. Senator Mark Warner came out with a proposal where his bill is still under review of one concept of bundling payments, where everybody involved in a certain treatment is getting a fixed fee. Now, that's not necessarily the silver bullet, but the reality is that we've got to look at the quality of care in terms of what these people are receiving before we just say that you're going to get more coverage. People may be somewhat satisfied with Medicare, but if we're out of money in the next several years, they're not going to be that happy. And we obviously still have a lot of challenges in terms of the quality of care that people are delivering. Otherwise, we wouldn't be trying to take out all of the big dollars within Medicare now in order to pay for the new reform bill.
Dr. Sreedhar Potarazu, great to see you again, doctor. Thanks for coming.